Meet Dr. Robert Gallo, a global HIV specialist who has spent over 20 years researching silent transmission routes and educating underserved communities across Asia and Africa. Known for his compassion and fearless truth-telling, Dr. Robert believes the real fight against HIV begins not in labs, but in everyday awareness. In today's video, Dr. Robert reveals 5 places we never expect HIV to be, yet where it may be silently spreading. His mission: to arm you with the truth, so you can protect yourself and others. We fear HIV from sexual contact, but rarely do we consider that it might wait for us in places we trust with our bodies. In 2018, a well-educated young man from a major city walked into a barber shop for a new haircut. He left, unaware, carrying a virus that would change his life forever. 2 years later, HIV was detected, traced back to a tiny nick on his scalp and the reuse of a blade. We go to get clean, feel pampered, make a change, and leave with a risk we never even heard of. Today, we uncover 5 everyday places where HIV can silently spread and exactly how you can safeguard against them. Number 1. Dental clinics. Improper sterilization. Dentists handle our mouths, places full of blood and saliva. Instruments like drills, scalers, and syringes should be sterilized between patients. But in clinics where standards aren't enforced, these tools can carry microscopic droplets of blood. HIV doesn't thrive outside the body, but if a scalpel or needle is used on someone with HIV and improperly sterilized afterward, those viral particles can survive for hours. That presents a risk to the next patient. Studies show that in low-regulation settings, especially in rural clinics, improper sterilization has been linked to outbreaks of HIV and hepatitis. While these are rare in regulated areas, they still occur under the radar. Always ask if the instruments are autoclaved or single-use, and look for visible indicators like sealed packaging for needles and syringes. Number 2. Tattoo parlors and body piercing shops. Tattoos and piercings involve needles that enter the bloodstream. It's vitally important that every needle and ink pot be sterile and used only once. Unfortunately, some shops reuse gloves, skip sanitizing surfaces, or share ink, increasing the risk of transmitting HIV. In decades past, outbreaks of HIV and hepatitis were traced back to such unsafe practices in unregulated parlors. Today, licensed establishments in many countries pride themselves on hygiene, but there are still underground studios and informal pop-ups that cut corners. You need to be sure your artist uses brand new, individually sealed needles and pours ink into disposable cups. Never skip the license. Ask your artist to open the needle in front of you, and choose places that follow strict hygiene protocols. Number 3. Barber shops and beauty salons. We trust barbers for grooming, but even a tiny nick can expose you to HIV. Razors, tweezers, and clippers often come into direct contact with blood. In regions without regulation, reusable blades aren't uncommon. If contaminated, they can pass viruses from one scalp to another even without visible blood. There have been documented cases worldwide of HIV and hepatitis B spreading through salon tools. Every small cut we ignore becomes a pathway for infection. Insist on single-use razors or require sterilization of tools visible to, not under a counter. Number 4. Home-based or injection treatments. In many areas, people offer for drips, vitamin infusions, or glucose therapy in private homes. Although convenient, these services often lack the sterile standards of clinics. Most syringes are meant for single use, but in low-price services, equipment is often shared. In 2019, over 700 children in a single region were found HIV positive, traced back to a home injection provider who reused syringes. This risk isn't minor, it's lethal. Even if someone feels trusted, any infusion outside a licensed clinic can be dangerous. Never accept needles in unregulated settings. Always verify the provider's credentials and insist on sealed, single-use syringes. Number 5. Traditional healers and cultural procedures. Across cultures, tribal tattoos, scarification, or bloodletting traditions persist that often use shared blades or inks. When tools are reused without sterilization, those traditions carry risk. These procedures may hold cultural significance, but they must evolve to include clean, safe practices, autoclaved or bold instruments and gloves. The same goes for ritual circumcision and related rites. Many communities are already modernizing by using sterile kits. But in remote or less informed areas, infection risks remain. Respect traditions but insist ceremonies use new or sterilized equipment. Encourage leaders to adopt safer methods. Can HIV really spread like this? The signs. It's crucial to understand. HIV is bloodborne, not airborne. You can't catch it from surfaces or casual contact. When blood enters broken skin, even invisible cuts, it's a path for transmission. HIV particles die quickly outside the body, but microscopic blood droplets on metal can preserve the virus for hours. If the next user carries an open cut, exposure is possible. Global health agencies, like the CDC and WHO, confirm these risks low, but far from zero, especially in areas without sterilization protocols. HIV isn't hiding everywhere, but it can hide in places you would never suspect. Knowledge and precaution save lives. How to protect yourself. Here are practical steps to stay safe. Number 1. Dental clinics. Ensure autoclaving, single-use needles, and clean suction tips. Ask to see the process. Number 2. Tattoo and piercing. Demand sealed needles, fresh ink cups, glove changes, and sterilization records. Number 3. Barbershops and salons. Require fresh blades or visible sterilization for tools. Number 4. Home. 4. Injection. Always verify sealed, single-use syringes. If a provider refuses, walk away. Number 5. Cultural procedures. Use sterilized or boxed kits even if offered informally. Final message: fear less, but be smarter. HIV is no longer the death sentence it once was. Medical advances give people living with HIV normal lifespans. But prevention is still the best cure. This video isn't about fear, it's about awareness. The risk isn't everywhere, but the few places it can hide are unexpected. Let's choose transparency over silence. Let's protect each other with knowledge, not ignorance. Help someone today. Share this video. Subscribe for more health awareness. And remember, you don't have to fear HIV, you just have to be informed.